Hello everyone, this is Dr. Muskan and I welcome you to the Physio Info Island. I hope my previous videos must be helpful to you. And in this video, I will be discussing with you the abnormal neurological posture. What does that mean? Patients must be having stiff extended lower limb, or in some patients there is stiffness of the arms and it is flexed over the chest, right? So these postures are not coincidentally happening. These occur because of the severe brain injury. Depending upon the area at which the injury or the lesion is placed, this posture is happening in that patient. Okay, so what decides this posture? It is a very small and powerful structure in the brain which is known as the red nucleus. So let's have a look at the abnormal neurological postures and get to know that how, by just examining the posture, we can get to know about the brain injury location. So the first abnormal neurological posture is the decorticate posture. So it looks like this. In this posture, it is clearly visible that the arms are stiff and they are flexed towards the center of the body with the wrist curled up along with the fingers which are flexed. Okay, and the lower limb, it is rigid, extended, the knees are extended, ankle is plantar flexed, along with that it is turned inwards. So this is the presentation of the decorticate posture. The arms are flexed towards the chest and the lower limb is extended. Let's have a look at the decerebrate posture. What is happening in the decerebrate posture is the upper limb and the lower limb is extended. Okay, the arms are placed parallel like this, they are stiff and extended, and the forearm is pronated with the wrist in the flexed position like this, and the fingers are curled up. So they are placed parallel like this. Okay, now along with that, the lower limb is stiff and extended, the knees are extended and the toes are pointed and the feet is turned inwards. I hope the clinical feature of these both postures must be clear to you, that how they are presented. जब भी हम कोई ऐसा पेशेंट देखते हैं जिसमें ये सब सिम्टम्स प्रेजेंट है, ऐसे पोस्चर की कैरेक्टरिस्टिक फीचर्स प्रेजेंट है, सो वी मस्ट रिमेंबर दिस थिंग कि ये रैंडम पैटर्न्स नहीं है. Okay, these are the neuroanatomical reflexes which are present due to the disinhibition and the intact brain stem pathway. So after knowing the clinical presentation of these abnormal postures, let's get into the red nucleus. What is red nucleus and how red nucleus is connected with the presentation of these postures? Now the red nucleus. Red nucleus ये एक बहुत ही ज़्यादा small and powerful structure होता है which is present in the mid-brain. The red nucleus रूब्रोस्पाइनल ट्रैक्ट अराइज होता है. What is the function of रूब्रोस्पाइनल ट्रैक्ट? ये फ्लेक्सर टोन प्रोवाइड करता है हमारे अपर लिम्ब को. Okay, and similarly vestibular nuclei which is present in the pons and the medulla, ये क्या करता है? ये vestibulospinal tract को arise करता है. This tract provides the extensor tone to the upper limb as well as the lower limb of the body. ये इन tracts के function है. So let's get to know how these tracts affect the posture of our body. Let's talk about the brain areas and the postures. अगर ब्रेन की इंजरी रेड न्यूक्लियस से अबव के लेवल पे है, ओके, लेट इट बी इन द सेरेब्रल हेमिस्फीयर और इन द इंटरनल कैप्सूल, अगर उस एरिया पे कोई भी लीजन होती है, कोई भी इंजरी होती है ब्रेन की, it will cause the disruption of the corticospinal tract. Okay, but the red nucleus will remain intact. Rubrospinal tract का function वो perform करेगा and it will facilitate the flexor tone of the upper limb. And similarly, the vestibular spinal tract which is present in the pons and the medulla, it will perform the extensor function. It will remain uninhibited because of the disruption of the corticospinal tract. Okay, so वो भी अपना extension का function perform करेगा in the lower limb. So these tracts will give rise to the decorticate posture, जिसमें upper limb is flexed and the lower limb is extended. So this type of lesion is the supratentorial lesion and it has better chances of recovery, it has better prognosis. Injury has occurred below or at the level of the red nucleus. What will happen? The corticospinal tract, which is present above the red nucleus, will get disrupted. Along with that, the rubrospinal tract, which is arising from the red nucleus, its function is also gone. So only vestibular spinal tract is functioning and facilitating the extensor tone of the upper limb and the lower limb. This type of lesion is infratentorial lesion, and it reflects the involvement of the brain stem, which is more severe and it has poor prognosis, lesser chances for recovery. So just by having a look at the posture presentation, we can get the idea of the brain injury's location and know about its prognosis. So now let me give you a quick recap of the posture presentation along with the involvement of the areas. Decorticate posture. Corticate is coming, this means the cortex is gone and the red nucleus is paired, due to which the arms are flexed because of the facilitation of the flexor tone in the upper limb. Decerebrate posture, 2 times E is coming, this means everything is gone along with the red nucleus, so there will be full extension in the upper limb as well as the lower limb. I hope this video must be helpful to you and stay tuned for the upcoming videos.